Major Depressive Disorder, or MDD. Major depressive disorder affects 1 in 7 people. Australia-wide, that equates to 2.83 million people. Chances are that you or someone you know will experience an episode of major depressive disorder at some time in their life. With such a high prevalence rate in the community, it's important to know what to look out for when it comes to major depressive disorder. Signs and symptoms include sadness, losing interest, lack of pleasure in things that once gave you joy, a low energy, insomnia and lethargy, a change in appetite, be it increased or decreased, and tragically in some cases, self-harm. Major depressive disorder will not only affect the individual, but their families and communities as well. The individual will be left feeling lonely, worthless, and not functioning at their highest self. Major depressive disorder also comes with a huge economic burden, with Deakin University estimating that together, depression and anxiety costed Australians $12.8 billion. The monoamine hypothesis posits that major depressive disorder is caused by reduced monoamine function in the brain. This theory suggests that a lack of neurotransmitters at the brain synapses causes the so-called chemical imbalance that results in depression. In reality, we now know that depression is much more complex than this. Studies on the brains of those with major depressive disorder have shown changes and abnormal activity in the prefrontal cortex, the anterior cingulate cortex, the ventral striatum, the amygdala, and the hippocampus. Treatment for major depressive disorder falls into 4 basic categories: medicinal, physical, psychological, and self-help and alternative. Medicinal treatments include antidepressants, mood stabilizers, and in some severe cases, tranquilizers. Physical treatments include electroconvulsive therapy and magnetic stimulation. Psychological treatments include cognitive behavior therapy, or CBT, interpersonal therapy, or IPT, positive psychology, psychotherapies, and counseling narrative therapy. Self-help and alternative methods include exercise, yoga, meditation, massage therapies, vitamins, and some traditional herbal remedies. There is no one-size-fits-all treatment for major depressive disorder, and a lot of the times treatments carry severe side effects. That, in combination with the increasing prevalence, leads to a lot of study today for solutions, cures, and treatments to help us understand major depressive disorder. Current research includes neural stem cells, neuroadaptation, new drugs, pathophysiological subtypes, comorbidity, biomarkers, drug targets, deep brain stimulation, medical imaging and brain mapping, artificial intelligence, and depression's connection to other diseases, just to name a few. If the content presented to you today has incited any feelings of self-harm or suicide or crisis, contact Lifeline on 13 11 14